To help clinicians to support patients to play a more active role in managing their health and healthcare, we need to consider what happens in the private space of the consultation room, behind closed doors. The following two contrasting consultations demonstrate how, by adopting a coaching approach, clinicians can better support patients to feel more confident in managing their health and healthcare.
Your cough is bad again, Mr. Baker. When we last met, you said you were trying to give up smoking. How has that gone?
Well, I've not given up completely, but I'm not smoking much now. I think I'm doing well.
Well, that's good. But you do know, don't you, that you really need to stop smoking completely now?
Yeah, but I've managed to cut down. I'm only smoking 5 a day now, where I was smoking 30. I feel a whole lot better for it. I can make it down to the pub now without too much trouble.
Well, that's a good start, but you must understand that any smoking is going to continue to damage your lungs. You really do need to give it up altogether if you want to help your lungs now.
Yeah, I know, but it's so difficult to give up altogether. I mean, that cigarette after my dinner, it really helps me relax. See, I get so wound up with all that's happening in my life at the moment. It's the one thing that I really enjoy. It calms me down. And anyway, the damage is done now.
Well, lots of people think that smoking calms you down, but actually, it's a known fact that smoking doesn't help you relax. In fact, it does the opposite.
Yeah, well, smoking helps me relax. When I gave up before, I put on a load of weight, and that's not good for me either, is it, Doctor?
I understand that, but in fact, giving up smoking is more important for you right now than putting on weight. And there are other things you can do to relax. Maybe you could think of something else to take your mind off things.
Yeah, right.
I know it's difficult, but there are things that can help. Have you tried nicotine patches?
No.
Well, nicotine patches really increase your chances of stopping. Did you know that? I can prescribe you some now. Would you like to try some?
Yeah, I suppose so.
Here you are. See how you get on with these. So, Mr. Baker, you've told me your cough's bad again. I'd like to get an idea about what you've been doing since we last met to stay healthy with your COPD.
Right, well, I've been taking those inhalers the nurse showed me how to use, and I've cut down my smoking from 30 to 5 a day now.
Oh, well done. That's fantastic. How did you manage to do that?
Well, it took a lot of willpower. See, I've been staying away from my friends who are heavy smokers because it's really difficult to have just one when I'm around them. Basically, I'm just down to the ones I really can't give up, like after meals and when I'm feeling stressed.
So, you've done really well in cutting down, and you feel that the 5 a day are the ones you need the most. Tell me a bit about what's good about smoking then.
What's good about smoking them?
Yeah, what's good?
I just need something to finish off my meals. When I tried to give up smoking before, I put on a lot of weight. See, when you've got as much stress in your life as I have, you need something to help you calm down.
Yeah, I can really understand that stress can be difficult to deal with and that you'd rather not put on any weight. If I was to ask you, on a scale of 0 to 10, where 0 is not at all important and 10 is very important, how important would it be to you right now to have a go at giving up altogether?
Giving up altogether?
Yes.
Ooh, about a 6.
Okay, a 6. What makes it a 6 and not a 4 or a 5?
Well, it's a 6 because I know it's not good for me. My daughter's worried about me. I have to hide the ciggies when she comes round because she gives me a hard time about it. And, yeah, I don't like the grandchildren seeing me smoking. I mean, it's not a very good example, is it?
I can see that it's difficult. On the one hand, you know it's continuing to damage your lungs, your family is worried about you, and you don't want to be a poor example for your grandchildren. On the other, you really enjoy those few cigarettes you have now. They relax you and help you control your weight.
Yeah, that's it.
What would it take, do you think, to move the importance up a bit to a 7 maybe?
Ooh, I can't think of anything right now. I mean, it's not that I don't want to, it's just that I don't think I can do it right now.
Yeah, I can see that. So it's not so much that you don't want to, it's almost like, how can I do this?
Yeah, that's right. See, I tried before, but I didn't like the weight I put on.
Well, it's not inevitable. There are ways of avoiding that. Some of my other patients have found it useful to talk to our nurse who helps people stop smoking. Would you like to try that?
Yeah. I'll give it a go.
Okay. Shall we make an appointment for next week then?
Yeah, let's do that. We hope that these 2 consultations have shown how the following techniques can change the potential outcome of a consultation. Really listening to what's important to the patient, rather than what you think is important to them. Helping them explore their mixed feelings, in this case, about giving up smoking. Reflecting back what you hear. Guiding them to options that can help them, rather than telling them which option they should choose.